Afternoon. I'm Juanita Vero, one of your 3 Missoula County Commissioners, and it's April 30th, and we're here with your Joint Information Center daily update video. And I'm here with Gwen Jones, the Missoula City Council Vice President, and we have our guests. Well, I'm sorry, Gwen will introduce our guests. Go ahead.
Thanks, Juanita. We have today Dr. Kevin Eichhorn, Emergency Department Physician and President of the Medical Staff at Providence St. Patrick Hospital. And we also have Alexander Jaley, a cardiologist with the International Heart Institute, Providence St. Patrick Hospital also. So our 2 doctors are going to give us some great information today. And the main issue we're trying to address today is we're looking at not only how, but also how often patients are using hospital services in Missoula and what the challenges are. So they're going to talk about that flow of patients coming in and what we as consumers should be paying attention to so that we're doing it right. So I have the first question. Dr. Eichhorn, Dr. Jaley, could you give us an idea of what you're seeing at Missoula hospitals?
I guess I'll start since we usually end up being the front line. You know, our volume in the land of COVID is down about 60% from normal. So I think people are doing their best to sort of steer clear of the hospital in general, sometimes for better, sometimes for worse. We are seeing probably 20% of what we see is respiratory related. And so all of those people, unfortunately, there is some potential for COVID in any of them. So we're using PPE to evaluate things that normally back in the day when I was training would just be, you know, going to go see somebody with a cold. So that's kind of how things are going right now. We, right from the doorway, are triaging potential respiratory patients away from everybody else or vice versa to try to keep people safe. And I think it's working reasonably well.
Yep, I would add to that a very similar story. Our numbers are also probably about half of where we traditionally run from an inpatient side of things, which is a double-edged sword. We're glad that people are properly socially distancing. On the other hand, heart disease remains the #1 killer, both in Montana as well as the United States, and is has a deaf ear to COVID. People still have heart attacks, and we are advocating for folks, if you're having symptoms, COVID or no COVID, we advocate people coming in and being evaluated. We've seen people come in that unfortunately have presented late and either have damage that we're having trouble reversing, or have new symptoms such as heart failure that could have been avoided.
Thanks.
And I guess that you kind of have already answered this. The second question was talking to us more about the risks of not coming into a hospital for treatment for heart and stroke symptoms. Did you want to expand on that a bit more about the risks?
Yeah, I think from a heart standpoint, you know, people who are having, you know, unrelenting chest pain, for example, those are people that really need to seek evaluation. People who have had an event that happened days ago, weeks ago, that might be something where you call your cardiologist or your primary care physician before going into the emergency department directly. But people who are having active symptoms, particularly life-threatening symptoms, we really advocate for those people to come in and be evaluated. And
come in early, you know, as Alex sort of alluded to, you know, if you come in late with heart disease, late with stroke, the heart and the brain, they're not particularly forgiving. It's a lot easier to reverse something that's early on in its course than it is to deal with the damage when it's sat around and smoldered for a while.
Yeah.
And so on the issue of heart attack and stroke, can you give us some of the specific symptoms that should lead to people calling 911 and or getting to the hospital?
Sure. You know, from a stroke perspective, that's probably more straightforward of an answer than than heart disease. With stroke, it's one-sided numbness, weakness, slurred speech, visual disturbance. For aggressive treatment, for the more serious strokes, clotbuster drugs generally are the thing that we're looking at under 3 hours. So, if you're spending a lot of time thinking about it and trying to decide, you're wasting time. And we want to see those people early if you're having pretty serious symptoms. In terms of heart disease, chest pain, trouble breathing, especially if it's exertional, goes into the neck, the arm. Those are the main things that we're thinking of. Alex, I don't know if you have anything to add about that.
Yeah, I would just add that sometimes when the chest pain isn't as classic, or if people wait, the chest pain resolves and then they notice more shortness of breath and fluid accumulation. Their legs start swelling, trouble laying down flat at night, that type of thing, which can represent some damage done to the heart already. So people who might be having that issue, we would certainly advocate that they get in and be evaluated.
Great.
And then I guess, can you guys speak to other symptoms that people might be experiencing that they should then also seek urgent care or go to the emergency department that aren't necessarily related to stroke or heart issues?
Sure. Well, the other thing that are common reasons to come to the emergency department, things like abdominal pain, appendicitis typically starts around your belly button, works its way to your right lower quadrant. For some reason, this last week, I've seen quite a few people with bad gallbladders. That's sort of pain, vomiting, nausea, right upper quadrant or upper tucked up underneath your rib cage in your belly. If you're throwing up, having diarrhea to the point where you're getting dehydrated, lightheaded, not urinating, we need to see you.
How should people decide if they need to visit an emergency department at a hospital or if they should just call a regular doctor's office? What's your advice regarding that?
That's always a tough one because on the one hand, you want people to choose the appropriate resource, and sometimes it's sort of hard to say. I would say, if you have heart attack symptoms, stroke symptoms, you're having a fair amount of abdominal pain, most of the time your doctor's going to tell you to come to the ER, and you're probably just as well just to come in rather than waste time calling your doctor and asking for their advice. If you've got a deformed limb from falling out of a tree, or a big huge wound and you can see a tendon in it, those things are pretty straightforward. Most people know what to do. For things that have smoldered, that have lasted days, and you're still undecided whether or not you need to be seen, that's a great time to call your doctor and get some additional advice.
Great.
I like the exposed tendon advice. That's good Montana advice. Yeah, and I think from a heart standpoint, I think a point of separation is people that are having ongoing, unrelenting symptoms. We would advise them to get evaluated. Symptoms that happened 48 hours, 72 hours, what have you, probably okay to give your physician or cardiologist a call. But if you're having chest pain that's not going away, time to seek an evaluation.
And we've been hearing stories of folks that are concerned about seeking medical treatment because they're concerned that they're going to expose themselves to COVID-19 at a hospital or a clinic. How can you allay those fears?
Yeah, that's definitely something that's happened. I've had several people in the last few days who are relatively terrified about even being, they made it to the ER, but then when the decision came to put them in the hospital, were really pretty terrified about being admitted. And the things to know is that we are taking very aggressive measures to try to avoid exposure. Like I mentioned at the beginning, we divide patients right as they walk through the door. We have universal masking for all staff in the hospital, so that if one of us happened to be, as any of us could be, a potential asymptomatic person, we're decreasing our potential to expose somebody. There currently, I don't know if there could be 2 people in the hospital with COVID. It may not be, that may not be the most up-to-date information, but honestly, the hospital has had very few cases. Missoulians and Montanans in general have done a fantastic job, and we've seen, very few cases.
Yep, I would just add to that too, that people that come in an emergency situation where they're either whisked off to the cath lab or to an operating room, if there's any suggestion or concern that they might be positive from a viral standpoint, they're treated as such until the test results come back. So we're being extremely cautious for everybody that comes in, whether it's people coming into the outpatient clinics or via the emergency department.
Great. We have heard stories also of people not scheduling appointments because they don't want to use telehealth or they think it's too complicated. Can you talk about the reality of clinic appointments versus telehealth, and what does that mean? What is telehealth? When can people use it? When is it not the right thing to use as a tool?
Yeah, we started telehealth here in our clinic about 3 weeks ago, and I'll admit I've been pleasantly surprised by telehealth. You can learn more about somebody than you think by having this type of face-to-face interaction. Patients can show us rashes, they can show us swelling in their legs, things that you can't get from a phone conversation. You can assess how somebody's breathing, for example, when you can watch them. There have been patients who have been reluctant to sign up, either from an intimidation standpoint, thinking that it's going to be complicated to get set up for a video conference. But, even people who have a smartphone can effectively do a video conference. We have nurses that work with them and do a practice run before we ever have the visit themselves. So I will say one thing that may come out of this is that we find that there may be a niche for telehealth even when the dust settles from the viral pandemic. Patients that have a difficult time coming in, patients that live 2.5 hours away, I think there'll be a role actually for telehealth, and this was sort of an icebreaker to get that started.
Great, thanks.
Yeah, I live an hour away, and I just had my first telehealth appointment this morning, and it actually worked out really well. So
yeah,
yay Providence, St. Pat's, and I thought it was going to be awkward and silly, and no, it was really easy, and the nurses helped me get set up before the appointment and followed up with me afterwards, and it worked out incredibly well. So it was a good experience. If you're due for a mammogram or a colonoscopy, what's the guidance for that?
Boy, I don't think Alex or I either are the pro at this answer, but I would say, I believe mammogram is starting to ramp up a little bit. I think colonoscopy, because it's an invasive procedure, is still a little bit operating on a pretty urgent basis, meaning if you're having symptoms, you probably can get your colonoscopy. If you are asymptomatic and you're on your 10-year cycle, a few months is probably not going to make a huge difference, and it's probably not going to happen in the near future. I think hopefully this summer things settle down enough that they can ramp that up. But my understanding, like I said, mammogram is starting to come online pretty fast.
And I would just add that starting the first week of May, so next week, the hospital is sort of going to that next level of urgency for getting patients in for procedures exactly like colonoscopy. The imaging is going to start to be more expanded than what it's been, because thank goodness, Montana has been spared, unlike the rest of the country in terms of our viral numbers. And most hospitals, I think, in our region are going to start relaxing some of the indications to get people in, and so we're specifically starting that on Monday, and keeping sort of a close eye on how that affects the equipment usage that we have to keep people safe in the hospital, the personal protective gear, and also just to see if it affects any of our numbers that are positive viral patients.
Okay. And the last question for both of you today is just to make it super clear, if someone is in the high-risk category for COVID-19, if they have asthma, type 1 diabetes, other issues, if they're over 65, should they just stay home from medical care, or what do you advise them to do?
I think if they're having symptoms that need to be evaluated, your risk of getting COVID exposure in the hospital is probably lower than your risk of going to the grocery store. So if you need to be seen, it's safe.
Yeah, I just had a phone call not an hour ago from a patient of mine that's well into his 80s, and has had a significant change in his breathing and chest symptoms. He's a higher risk COVID patient. His risk of heart disease is much higher. We lose 2,000 people in Montana every year to heart disease. I think our numbers, Kevin, correct me if I'm wrong, the deaths that are COVID related in our state, I believe, are still under 20.
Yeah, I think that's correct.
So what we have here now is a list from Centers for Disease Control of those high risk, those who are at high risk for illness related to COVID. And I'm just going to read through the list, and then if you guys have anything to add to it or correct us, let us know. But like Gwen was saying, people 65 years and older, or if you live in a nursing home or a long-term care facility, if you have chronic lung disease, moderate or severe asthma, people with serious heart conditions, folks who are immunocompromised, and those conditions can include cancer treatment, smoking, bone marrow, organ transplant, immune deficiencies, like other immune deficiencies like rheumatic arthritis. Is that something that you're thinking of, or is that
as an example of a
yeah,
that somebody would be on an immunosuppressive agent like a steroid like prednisone?
Okay. Poorly controlled HIV or AIDS, and then I guess, like you were just saying, prolonged use of corticosteroids and immune weakening medications. Obese folks with a body mass index of 40 or higher, people with diabetes, chronic kidney disease, undergoing dialysis, and liver disease. Is there anything else we can add to that list of folks that...
I don't know who's left after that list.
That sounds like a fair representation.
Yeah, okay. Well, thank you guys so much for your time. Is there anything else that you want to tell the community, or anything that's frustrating you and that you really just want people to understand?
No, I just would like to reiterate, I'm just grateful that we have avoided a pretty major outbreak in Montana, and I think it's hats off to our community. And as the restrictions start loosening up, just please use good judgment. And the more things relax, the more potential for it is to come back. So just be careful.
And I would say the same from healthcare providers back to the community. We've appreciated the support, and we appreciate the effectiveness that the social distancing has had so far. I really think it's made a huge difference in our state.
That's great to hear.
Yeah. We've had coffee and cookies and all kinds of stuff delivered to us, and we are very grateful. Thank you very much.
Yeah. And that doesn't need to end.
Right.
I want to know, are you guys howling every night at 8 o'clock?
Oh man, my daughter makes sure we're out in the back porch howling every night.
Excellent. Excellent.
That's great. Well, thank you all. Remember to wash your hands, get a face covering, wear a face covering, keep your distance, be kind, and yeah, we'll talk to you tomorrow. Thanks, everyone.
Thanks, everybody.